Myself, Vikash Jaiswal. I'm a cardiology research fellow from Larkin Community Hospital, Florida. And today it is my great honor to host Dr. Julia Grapsa here.
Thank you so much, Vikash. My name is Julia Grapsa. I'm from Brigham and Women's Hospital in Boston, United States. And I'm also Deputy Editor for European Heart Journal Imaging. It's a great pleasure to be here at AHA 25.
I would like to ask about the cardiovascular imaging, how we see the role of AI in cardiovascular imaging.
That's a very hot topic at the moment, Vikash, and thank you for asking. So it has a lot of implementations, artificial intelligence. You remind me that about a decade ago, when we started thinking about artificial intelligence, we would think, oh, what are the threats? But it has a lot of advantages, and there have been many trials that they are detecting, for example, from ECG, they are detecting valvular heart disease, or for example, they can make the interpretation, image optimization for echo easier for us as clinicians. And then, of course, we take it a step further, as we have an imaging session today about this topic on how we can implement artificial intelligence in large populations such as India, Africa, and, for example, remote areas to promote equity in assessment and evaluation.
Thank you. I would also want to ask how we see the recent trials who's focusing on cardiovascular imaging with the AI roles in detecting the MINOCA and all other aspects of cardiology.
So this is very interesting, and thank you for asking, because we know that women are underdiagnosed, undertreated, and there is a delay. If they are delayed, there is a delay in diagnosis, then there is also a delay in treatment. So a lot of women, they will actually spend months undergoing coronary angiography and not getting the right test because they do not have the appropriate pathways, or at least not yet. So artificial intelligence gives us the way to actually risk stratify women and, for example, speed up this test and then get the right test for the right patient and, of course, the right approach of management. So I can see huge implementation in clinical practice, and then, of course, in the next guidelines on how artificial intelligence will benefit the diagnosis for these patients.
Also, there are many rare diseases like amyloidosis, sarcoidosis, and other cardio-oncology aspects where breast cancer. What can we expect from AI? How can this simplify our diagnosis, reducing the time for diagnosis and curing the patients on such patients?
Again, if you think that there are pathognomonic features on the ECG that for example, they can make us suspicious of amyloidosis or other cardiomyopathies or cardiovascular disease in women, let's put it that way, then I'm sure that if we implement these algorithms, deep learning, into our everyday practice, starting from a simple test such as the EKG, then we will be able to diagnose easier these pathologies.